دايما one of the doctors in the medicine clinic for today may confirm that you are hello, I'm Dr. Yasin, one of the doctors in the medicine clinic for today. May I confirm that you're Mr. Ali and you're 40 years old?
Yes, doctor.
Mr. Ali, today we are here to discuss about your health condition, and I'll be happy to examine you and address your concern. Is it okay for you?
Yes, please.
It came to my knowledge that you have a problem with your vision. Can you tell me more about it?
Yes, doctor. I have a diminution of my vision.
I'm very sorry to hear this. Since how long, Mr. Ali?
This started 1 year ago, and it's getting
Okay,
worse.
I'm very sorry. So it started suddenly?
No, it started gradually, and recently, last year was very severe.
Okay. Is it in one eye or both eyes?
It is in both eyes.
Okay. And what do you mean exactly by vision problem? Is it blurry?
Yes,
Is it double?
not double.
Not double. Okay. Is it mainly in the night time or specific time of the day?
No, all the day.
Is it in the your peripheral vision or your central vision?
More in my central vision.
More in your central vision. Okay, right. And is it related to the color vision also?
Yes, color vision is affected.
Is it painful?
No,
Do you have any redness or discharge coming from your eye?
no.
With this problem with your vision, do you have any headache?
Yes, I have headache.
Since how long?
This is now for maybe the last. It was in last 1 year, but last 6 months, it is making becoming worse.
Okay. And which part of your head it's paining?
It's all over my head, doctor, and it is continuous all the time of the day.
It doesn't have any variation, increase morning or late evening.
Um, no, I it is all the day.
Does it increase with like leaning forward?
Yes, I think so. Yes,
Does it increase with cough?
yes, coughing and sneezing make it worse.
Does something make it better?
Sometimes I try to take painkillers, make it slightly better.
Okay, if I'll grade 1 to 10, how much you can give pain score?
Maybe 5 to 6.
Hmm. Okay, right. And do you feel sick with this?
Maybe when coughing or sneezing, sometimes I feel some thickness.
Okay, right. Did you ever throw up?
No,
Any weakness in any part of your body?
no,
Any stiffness of your neck?
no,
Any difficult of swallowing?
no,
Speech change?
no,
Any tingling or numbness sensation?
no.
Any any abnormal movement of any part of your body?
Yes, doctor, I have been diagnosed with fits, and this have been there, this diagnosis for now 2 years.
Okay. And what medication you are taking for this?
I'm taking phenytoin.
And you're compliant to the medicine.
Yes,
How much is the dose?
I can't remember.
What was the last time you checked with the brain doctor?
Recently, and it was okay.
And it was okay. Okay, right. Since 2 years. Okay. And what was the last time you got fits?
Maybe 2 months ago.
Okay. Do you have any problem with the control of back passage or water work?
No, it's okay.
Okay. Do you have any problem with the walk?
My I can walk. Okay, my walk is okay.
Okay. And did you, apart from fits, having fits, did you ever diagnose with any other health condition?
Yes, I have been diagnosed with high blood pressure, and this diagnosis also started about 3 years ago, and I'm taking lisinopril.
Are you compliant with the medicine?
I'm compliant with the medicine, but my blood pressure is not controlled yet.
Okay. Okay. Right. And no change in the dose.
No.
Any other health issue I should be aware?
No,
Apart from lisinopril and phenytoin, any other medication?
no,
Okay, do you have allergy to medicine?
no,
Sorry to ask, any illicit drugs?
no,
Did you hospitalize before for any
no.
reason?
One time, due to high blood pressure attack, and I discharged the same day. It was in the ER only.
Okay, I'm sorry for this. Did you have any high body temperature?
No,
Any weight change?
my weight is okay.
Any loss of appetite?
No,
Any bumps and lumps?
no,
Any weather preferences?
no,
Any dizziness or standing position?
no,
Any joint pain?
no.
Any back pain?
Yes, there is some back pain.
Which area of your back exactly?
It is all over my back, and it has been there for a long time now, maybe years.
Okay, did you seek medical advice?
No, I have some birth issues regarding my back. It has been there for a long time, and I'm trying to compensate regarding this issue.
Can I see my patient?
Yes,
Okay, is this back pain in morning specific time of the day?
no, doctor, it's all the day.
Is it with stiffness?
Is it with the stiffness? No stiffness.
Is it radiated to the leg?
No,
Okay.
this is the
Okay.
back of the patient. What do you want to see else?
I want to see the front. Do you have any hearing issue?
Hearing issue? Yes, I have some hearing issue, but I'm planning to visit the doctor. I didn't seek medical advice yet.
Do you have a family history of similar problem?
I'm adopted, doctor.
You're adopted. I'm very sorry to hear this. Okay. Do you have any skin changes?
Yes, I have some skin changes, and I can show you.
Okay. Do you have any alteration of your bowel habits?
My bowel is okay.
Any water work change?
No, my water work is okay.
Okay. Any tummy pain?
Tummy pain? No.
Any awareness of your heart beats?
My heartbeat is okay.
Any cough?
No,
Any breathing discomfort?
no,
Any chest pain?
no.
Can I examine you?
Yes, please. What do you want to examine?
I want to full vital sign of the patient. Do
Yes.
you smoke, Mr. Ali?
Yes, I smoke about 2 to 3 cigarettes per day,
Okay. Do you drink alcohol?
occasionally.
I would like to advise you to quit smoking. Okay, since overall it can be related to your condition. Okay. Do you
Okay.
drive?
Yes, I drive. But recently I can't continue driving. But if this the condition could be resolved so I can continue driving.
Yeah, okay, I appreciate that you stopped driving. Oh, I will let you know, Mr. Ali, after assessing you, okay?
Okay.
Okay, do you have a diet or any specific diet of food you're following?
No, no.
Okay, I need vital signs of the patient.
Okay. Blood pressure 150 over 100. Heart rate is about 80 beats per minute.
Mhm.
Temperature and respiratory rate is okay.
I need to examine the patient's eye.
Okay, examine
Uh,
doctor.
Visual acuity,
Visual acuity is reduced up to hand movement.
both eyes.
Yes.
I need to offer fundoscope.
Okay.
Is there anything in the fundoscope?
Yes. This is the fundoscope.
Okay, to do a visual field.
You can't
If it is
continue with visual field with hand movement.
okay, I need to do okay. Fundus examination. Okay. Then I need to check the hearing of the patient
Okay,
by
what do you want
using
to do?
Weber test and Rene test.
Okay. It's impaired, doctor. No need to proceed.
Okay. Then I need to examine the patient for pronator drift.
Okay. Pronator drift is negative. What do you want to do else?
I need to examine the skin lesion which patient have coffee or lay patches is there. I need to count it.
Okay.
And I need to see the axilla for any axillary freckling.
Okay, this is the axilla.
And I need to see the neuroma.
Okay. There is
Then
some
I need to
neuromas in the back.
okay. Then I need to examine the abdomen for any palpable mass, for
Examine,
any
doctor.
pelvic
Examine. Okay.
and for any organomegaly.
Okay. There is
Then
no pervy could be appreciated.
okay. Then I will examine the heart for any murmur,
Examine, doctor. No murmur.
any irregularities.
No irregularities in the pulse.
Okay. Okay. Then I need to examine the back for deformity, for tenderness, and for movement.
Okay. Movement is restricted.
Okay. Okay. Um. Uh. What else? I need to examine the lung also for
Examine.
any fibrosis, for any fibrosis.
Yes. There is bilateral fibrosis could be appreciated in the inspiratory crackles, not changed with cough.
Okay. Mr. Ali, may I ask you what's your concern?
Yes, doctor. My concern about this diminution of vision could be something correctable.
Your concern is very valid. I think, Mr. Ali, after I examine you, that you have what we call a medicine optic atrophy, where there is some damage happen in your the main nerve of the vision. And I think it's related to a bigger disease, which we call in medicine neurofibromatosis, where there is abnormal growth going on in multiple organs. And one of this is your brain, one of this is your eye also, heart, lung, kidney, and can give this skin lesion which you have. It is also associated with this back pain which you have and this deformity. So what we need to do now, we need to do a multidisciplinary team from eye doctor, brain doctor, bone doctor, heart doctor, and lung doctor, and genetic team also, counseling team. And we will run some blood tests as well as imaging, and we'll come back to you with the result. Do you have any other concern? Regarding
Doctor, yes, continue.
I'm afraid to tell you that usually this condition is not reversible. However, we need to assess you first and see what's next.
Okay, so is this headache something serious? Could be cancer?
I'm afraid to tell you it can be some abnormal growth in your brain. Cancer, abnormal growth, it itself can be serious, but it's not necessary to be cancer. But we need to rule out any abnormal growth.
Okay, doctor, your time's up. Now discussion with the examiner. Present your positive finding, please. Diagnosis and differential diagnosis.
Mr. Ali, 40 years old, who presented with diminution of vision, which since last 6 months, and it's increasing, related to the color vision as well as central vision, on background of having headache with signs of increased intracranial pressure. He's also having some skin lesion in the form of neuroma, skin lesion, and he's having some back pain. On examination, I could appreciate some optic atrophy, as well as diminution of vision up to hand movement. So I couldn't do full eye examination. He's having some skin lesion in the form of coffee ole patches, neurofibroma, axillary freckling, and he's having also some lung fibrosis. I couldn't appreciate any abdominal mass. I couldn't appreciate any renal prurit. However, I need to complete my examination by doing assess the hearing acuity as well as doing genetic test.
Okay, so what is your diagnosis here and differential diagnosis of this?
Most like
Yes.
yeah, most likely in this condition it's neurofibromatosis with optic atrophy.
Okay.
However, I need to confirm about leash nodule and iris hamartoma. by doing slit lamp examination.
Okay.
The differential could be space occupying lesion compressing the optic nerve.
Okay.
Can be also phenytoin induced optic atrophy.
Phenytoin.
مش فاكرة بصراحة.
Okay.
Uh,
Less likely. Okay. What else?
can be hypertensive changes.
Did you
Uh,
did
reta-
you did you see any hypertensive changes in your fundus examination?
no.
Okay. So this is less likely also.
Mhm. Mm.
Okay. Continue, doctor, please.
Um,
Okay. So, how would you like to investigate this patient?
this patient he need multidisciplinary team from a neurologist, ophthalmologist, and genetic counseling team, as well as a cardiologist and pulmonologist. We need first to confirm for regarding his eye, we need to do slit lamp examination. We need to do fundus MRI. We need to do visual evoked potential to confirm about optic atrophy and to rule out other eye disease which might be present in neurofibromatosis. We need to do MRI brain to rule out any astrocytoma or glioma or meningioma, and we need also to do echo for any mitral valve prolapse and for any aortic regurg. We need also to do CT, HRCT for lung fibrosis, and we need to do ultrasound kidney for any pheochromocytoma or for any abnormal growth in the kidney.
Why are you expecting you need to do echo for mitral valve prolapse, I think?
Mm.
Okay, what do you expect in neurofibromatosis to have in the heart?
Um, it can give rhabdomyoma.
Yes, can give rhabdomyoma, can give restrictive cardiomyopathy and pulmonary artery stenosis. This is more common than other finding.
Okay.
Okay. Other than neurofibromatosis, could you suspect any other genetic test, genetic diagnosis could result in similar condition?
Yeah, liver optic atrophy, which one of the congenital disease, genetic disease which runs in family and give optic atrophy. However, patient has signs of a neurofibromatosis.
Okay. Any other also genetic disease could result in this fits and this abnormal, maybe skin lesions and also a vision problem?
Tuberous sclerosis, but patient doesn't have, is not fulfilling the full criteria of tuberous sclerosis, like gangrene patches, ash leaf rashes, or subungual fibroma.
Okay. Did you search for this? Ask to search for this in the patient, maybe fingers, fingernails or so?
Hmm.
Okay. Okay. Thank you, doctor.
Thank you.